This is One on One. Hi, Steve Adubato here, obviously remotely in our home in Montclair. We're pleased to be joined by our good friend who's been with us many times, usually in the studio, is Barry Ostrowsky, President and Chief Executive Officer, RWJBarnabas Health. Good to talk to you, Barry.
Hi, Steve. Great to be here. Hope you're doing well.
Yeah, we are. We're taping in the beginning of April. We'll be seen later. Barry's a big Yankee fan. I am as well. And we're hoping and praying there's baseball, but that's way down the road.
Agreed.
Barry, question. There's a strong connection between RWJBarnabas Health and Rutgers University, creating a model of delivering healthcare. How has that changed in this pandemic, A? And B, what do you think it looks like moving forward?
Well, I'll tell you something, Steve. We always thought that relationship was valuable to certainly both institutions and the public at large. Unfortunately, this pandemic has uncovered even greater value to that partnership. The research that's being conducted by Rutgers at every level, both in medical specialties and various other scientific disciplines, will add to our knowledge on how to best respond to pandemics like this. And so we have scientists looking at how we test for it, scientists evaluating how we treat people who have it, scientists actually looking at how we can better detect this kind of thing going forward. And of course, with respect to the delivery of healthcare, an academic base to a healthcare system, which, as you know, is something that we've always aspired to have, now becomes more meaningful because we have the depth of all of the subspecialty disciplines to be able to treat the patients who unfortunately become infected. So while we couldn't have been happier with the partnership, now we see in the time of crisis how valuable that partnership is in real time, not simply in something that we'll look back on in the research area alone, but in real-time delivery. It's made a great difference for the benefit of all of our patients and our staff members.
You know, Barry, we've been in a lot of meetings together, and one of the groups that I've been honored to facilitate conversations for is a group of folks who come together in Newark at Newark Beth, one of the hospitals in the RWJBarnabas Health system. And it's the Newark Community Advisory Board, right? These are leaders of all different stripes trying to look at the delivery of healthcare, particularly in urban communities like Newark. It's no secret as we do this program, we're finding out more and more that African Americans are disproportionately affected by this virus. Not that we know all the reasons for that. We spoke to Dr. Denise Rogers about that, who was very helpful. But in terms of this thing called social determinants of health, one of them being race, poverty, lack of transportation, unemployment issues, complicated stuff, connect the virus to social determinants of health and race. Well, what a question, Steve, I know.
Well, Steve, you've been a very meaningful part of that group. And of course, we're eternally grateful for your participation. I will say this adds another perspective and a broader dimension to the discussion of social determinants. What we know is social determinants have kept certain parts of our vulnerable communities unhealthy for generations. That level of unhealth makes those individuals a lot more susceptible to the most serious intervention of this virus. So if you start out with underlying comorbidities, whether it's respiratory or cardiac or kidney failures, you know, no matter what your age is, if you get this virus, you are in fact going to be worse off than others. So this simply proves that point. But I think even on a broader scale, our commitment to social determinants and vulnerable communities now couldn't be more important, not only for those who are already defined as vulnerable, but what this pandemic has proven to us is many more people are vulnerable when there's unfortunately a slight blip in lifestyle and the economy. And I think that as more and more people find themselves under incredible pressure to simply put food on the table, they've lost their jobs in many cases, they may not have a business to go back to when this is over. This now has swelled the vulnerable community dimension. And I would hope that that would bring recognition to the fact that an obligation to treat the vulnerable community is more important than ever, because there are more people who will now be included in the vulnerable community. What I hope it doesn't do, and this is critically important, you and I have discussed for years, there is structural racism in many parts of our society. Healthcare has long been one such part of the society that's tried to decouple itself from that, but hasn't cured that by any means. So I don't want the greater number of vulnerable people to, in fact, in some way camouflage the fact that there remains a structural racism piece to what we need to fight. So I think in total, this should bring greater recognition and even a higher commitment to deal with members of our vulnerable community.
And a quick follow-up on that, that is part of the social impact initiative at RWJBarnabas Health as well, correct?
It is. It's very much, look, we have a priority. We have a mission in our organization to make our communities healthier. And we're doing it through clinical care, which includes academics and research. And we're doing it through social programs that address social determinants. And that includes economic development, our whole anchor institution commitment. That's it. It's a pretty simple strategy with an easily defined mission. Its execution is not simple, but that's it. And so I think pandemics like this simply shed light on the fact that we have unhealthier communities that are larger than we had actually ever thought.
You know, we're taping on the, excuse me, I'm sensitive even touching my face because we need to be so aware of what we.
It's such a good looking face.
Yeah, thank you. A lot of makeup and good lighting, I hope. Barry, here's the other thing. Because we know the other healthcare systems in the state and other individual hospitals, even though there are only a few left, individual independent hospitals. Here's the thing I've been thinking about a lot, and I know you do as well. It strikes me that that right now and moving forward, there's more collaboration, more cooperation than ever before with hospitals and hospital systems that are intensely competitive with each other. Is that dynamic changed forever?
Oh, I believe it has, Steve. First of all, you're absolutely right. I have had the opportunity and candidly the luxury of collaborating with my colleagues who run what you have described as competitive healthcare systems. The collaboration has included no attempt to gain competitive advantage out of this pandemic. We speak multiple times a week and we share best practices. And while some of it is simply commiseration, much of it is about how we can be more productive. I have said to everyone from our trustees to all rank and file, business as usual will never be business as usual the way it was. And whether it's collaboration between and among healthcare systems and third-party payers and the government, there'll be an entirely new, and I hope this is the case, infrastructure to helping to finance and deliver healthcare. It has to be. And to that point, when we do get through things like this, we love to do a retrospective post-mortem, if you will. That's generally, in my view, not good enough. I've asked our team to keep real-time diaries, because if you're not codifying the challenges you find right now, when you look back, you won't remember all of them. And some of the nuances aren't nuances. So they're actually keeping a running log of process and productivity that needed to be better if we're going to face this again. And by the way, I happen to be one who believes there will be another something like this. I hope not, but we have to be prepared for it. So I think your point is well taken. There will be a very different look to our industry and candidly society's integration with healthcare.
Barry Ostrowsky from RWJBarnabas Health. It sounds like a cliche, but it couldn't be more true today than 2 months from now, 4 months from now. Be safe, be well. Thank you, Barry.
Thank you, Steve. Appreciate it.
We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, the Russell Berry Foundation, TD Bank, Rowan University, the Fidelco Group, NJM Insurance Group, New Jersey Sharing Network, Eastern Atlantic States Regional Council of Carpenters, and by Choose New Jersey. Promotional support provided by Meadowlands Chamber and by New Jersey Globe. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.